I'm trying to get in the camera. Am I in here right? Can you see me? Look, I'm trying to work this little iPad. Let me see. Okay, there
Okay,
we
there we
go.
go.
There you
All
go.
right.
I can
All
see
right,
you
let me
now, looking all pretty and
see.
stuff.
Thank you.
Oh wow. Okay, so we have an amazing show planned for you guys. We're going to talk about everything under the sun, but I mean, it's another edition of Uncensored United to where we get to talk about just about everything under the sun. And let's talk about the pink elephant in the room, COVID-19.
Yeah.
And I mean, it's got people wild, people just angry. Y'all notice that?
Yeah.
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 People just
Well,
angry.
they got to be angry because nobody really knows anything. They don't have no concrete way of. I think that we should have shut down the first 2 weeks,
Mm-hmm. Probably.
and that's the way it should have went. Even when you go, I don't know about you, Tasha, but when I was discharged, my mother was like, "You look mad more than sick," and I was like, "I am," because as a healthcare professional,
Mm-hmm.
how are you sending me to the pharmacy to pick up medicine? Don't know if I got COVID-19, and didn't give me a mask or gloves, but yet you want me to quarantine.
Right.
I know Tasha was different because she was in-house.
Right.
But it's just ridiculous, like the way that it doesn't seem like we have a set plan, and then already ignorantly talking about opening up the city.
Right. And that is just beyond to me. So, I mean, where do y'all stand with that? Do you believe that we should open up these states? What do you believe?
I don't think we're ready yet. I mean, those who have had the virus, they need to get tested first for the antibodies. So for me,
Mm-hmm.
I'll go on Monday.
Mm-hmm.
Some people have taken and retested, and they still have it in their systems, and they've
Oh,
taken
wow.
it twice. Yeah, twice
Wow.
originally had it.
So how did you get the test, Tasha?
So at the end of the day, we're not even sure if we're still carriers or what's going on because they haven't done
Right.
enough research to know that as of
Okay. So updating everybody. I didn't know. Tasha, you beat it?
yeah. So I was in
I
the
did not know.
hospital
I
for
knew that
15
Nick.
days. Yeah.
Okay, I knew that Nicole went through it. Lady Nicole went through it.
Yeah.
And wow, so we got two different people that have beat it. So shout outs to you and congratulations, because
Thank you.
Yeah.
this monster
Especially
is
Shout out
like
to you, Nicole, because
yeah,
it
Tasha,
was
that
rough
was
to
she
say the
was in the
least.
hospital. I wasn't that bad, but like Tasha said, we don't. Tasha, so how did you get the second test? How did you get them to do that for you?
I can't really
Is you
hear
hear me,
Nicole, so
Monica?
Oh, you can't hear. She said, how did you get the second test? How did you get them to do it for you?
I haven't done it yet. So Monday will see because I had got so bad with it. I
Mm-hmm.
had my follow up is not scheduled till May 8th. So I'm gonna go Monday. And he
Okay.
told me not to talk to him. Go straight to the lab. Don't talk to the girls at the window. I mean, he's
Mm-hmm.
treating me, like get in, get out. I don't want you to make contact with anybody.
Right.
Have your gloves, have your mask, be fully covered. So it's just a test for the antibodies for now.
Okay.
Oh,
Then he
okay.
said we'll go from
But
here,
at
but
least,
they don't even want you coming in the doctor's office. We did a virtual
yeah.
home call, and
What?
I had when I left the hospital, I had oxygen and everything. So
Well,
it was really bad.
Lady Nicole was sharing with me. She said that off air, she said that people are treating her like she got the plague or something. And I mean,
Yeah.
has it been the same experience for you?
See, when I got out the hospital, because I haven't been out like she had a chance to, I
Mm-hmm.
had to still go back into quarantine for 2 more weeks. So I'm only 3 days out of course. So I've basically been, in either the hospital or in my bedroom for almost 30 days. Because when I left, I
Wow.
still had oxygen. Yeah, I battled from ICU, so it was a
Mm.
little different probably for me than her. It
Mm-hmm.
was to the point where they asked my daughter, for a power of attorney. Like they kind of like wrote me off. So
Wow.
yeah, my lungs, like if I start moving around too much, I still gas, for air, but I don't
Right
want to keep
now, you still do?
using it. It damaged my lungs. When I left, I still had pneumonia too,
Rosemont.
as well. So it really wreaks havoc on your system, and that's what people have to understand. Like it attacks our lungs and our
Mm-hmm.
heart, and that's why people are dying so fast. So, you have to really be careful. So I'm afraid to be around, a lot of people.
Mm-hmm.
I just kind of stay in the house now. So I'll venture out tomorrow to go to the doctors, but I have not been to like grocery stores or anything.
Wow.
Yeah.
Do you know, like, maybe where you would have picked it up or anything?
Work.
Really?
Yeah, I worked
Okay.
6 days that week. We didn't do radio that week or anything.
Mm-hmm.
And we still open to the public until that Sunday. So that
Mm-hmm.
Sunday night, it was curbside. We considered essential workers.
Mm-hmm.
And that's what pretty much happened to me. I was coughing that day, and then that night I was running a fever of 100.4, and it went from 100.4 to 104.7. Yeah.
Jesus.
So it wreaked havoc on your body. I couldn't walk all of a sudden, like 3 days later. I couldn't walk. But the first hospital wouldn't give me the COVID test. So I know a lot of people probably having that problem, Nicole, that the first hospital wouldn't give it to me. So it was until I was unresponsive that my
Mm-hmm.
daughter called and, the ambulance, and then a different hospital gave me the test. So,
Wait, you said unresponsive, so you just
yeah,
blacked out?
that was it. Yeah. So 3 days from the hospital, first hospital telling me, oh, you don't have the flu, you don't have the strep throat, just go home and quarantine. Like
That's
everybody
what I
can't do
said.
that.
That's what happened to you. You said, Lady
Mm-hmm.
Nicole. Lady
Yeah,
Nicole, you said that.
that's what she's saying. The telehealth, they call you 3 days after and that was so I still had a week and a half to go before I finished my quarantine or whatever, and they were like, well, if you stop having symptoms, which mine was I couldn't smell my pussy. I was on my
Wait,
period. I
what?
called 911.
You couldn't smell your
I
what?
couldn't smell my pussy. I knew I had COVID.
Oh, I heard people say that,
I
to lose
called
the smell, the
911. I
loss of
said,
smell
ma'am,
and
she said,
taste and
can
all
you
that.
please send the COVID team? I can't smell my pussy. You need to get here
What?
fast.
Oh God,
Yeah.
really?
And then so I didn't really have bad symptoms. My worst thing was maybe I would have like hot flashes that maybe last like 5-10 minutes. First part for me. But like she said, you walking around, you don't know, and I had a daughter who 4 weeks.
Nicole, you're like really breaking up. Like we can't hear.
I can't hear
She's
mine at all. Yeah.
yeah, she's breaking up. Okay, so going back to what we were talking about, like, I
Mm-hmm.
mean, so you said that people are treating you like some kind of like pariah at this point, like,
Yeah.
we can't be around her, this, that, and the third.
And
That's
that's what made
crazy.
me skeptical about talking about it and
Yeah,
releasing the video. I didn't know the video when I was in the hospital was going to go viral.
Right.
It had over 400,000 views, and I was just
I,
telling people to
I saw it myself, and
yeah, I did not think it would
I
have
was
that.
like, oh, I know her.
Yeah. But when I tell you, out of everything I've been through in my life, this was by far the worst experience that I've ever had. So I can't stress to people enough. Like, you got to
Wow.
take this serious, and you got to think the African American community is affected the most. But we're the fastest that want to get back out there, down to the wharf, and all these other places. The monument yesterday, they gotta understand, like, this thing will kill you so fast, and it comes out of nowhere, because the doctor said like day 10, day 11, it takes a turn for the worse. They had prepped me and said, look, you may go all the way back to the beginning and may even have to go back in ICU, because when you're
What?
when you're containing 5 and 6 liters of oxygen, that's it. That's the highest it'll go, is at 6. I was at 5, after the first time. So like it runs havoc on your body, and
I
then
mean, what did it? Okay, so a lot of people want to know, like, what did it feel like? Like, I mean, does it feel like an asthma attack? Well,
it's
for those of us
it,
that have
it
asthma.
feels like you're being smothered at times, like you're gasping for air when you usually can go to the bathroom by yourself and you can't get there, because even with the
What?
oxygen on, you can't breathe. So I would call my daughter and I say, Jazz, stay on the phone with me, because the nurses don't respond. And that's what people have to understand. They don't want to come in there and be
Because
around
they don't
people.
want to infect themselves.
They're afraid. They're afraid. And when I got it, it was only 76 cases in Maryland. So I got it at the beginning, you
Mm-hmm.
know. And I would say, stay on the phone with me, because they won't answer me. And I'm
Mm-hmm.
afraid that I really thought I was going to die there. And you cannot breathe. It really feels like somebody is smothering you. And it's scary, when you've never had that happen before.
I'm so sorry that you had to go through that, but I'm overwhelmed that you triumphed.
now
Yeah.
I'm sorry.
Marcus asked her. Marcus asked her if they like anxiety. she, with
Lady Nicole, I can barely hear you. I'm like, I heard you say ask her something, but like you're choppy. I can't really hear you. You want to like disconnect and then come back on?
offer some type of anxiety or no?
I guess she wants me to ask you if they offered you some type of antibody or not.
They gave me, so day 10, I started asking for the drug that Trump was given. That he kept talking about, the
You
hydrochloroquine.
lost me at Trump. Sorry.
Yeah, but you know what?
What?
Before then, they was give me different antibiotics through IVs. They was poking my stomach. They was just anywhere, 7 liters of blood every day. Like it was a lot. Yeah, every day.
Wow.
And I asked for it because I heard it on CNN, and
Uh,
nothing was working at all for me. I lost 18 pounds in those 15 days. Like it was just felt like something was eating me internally, like within my stomach. I can feel it. I could see like my ankle bone popping out. And I'm a thick girl. And I could see, yeah, like it was just, I didn't want any food at all. At all.
wow.
So I started with that.
COVID-19,
And
horrible for your system, but great for weight loss. Hey.
yeah, yeah. And I got 6 rounds of that drug. I know
No.
they're saying now that it affects the heart. A lot of people are dying from it
Yeah.
too. So I don't know if it worked or what happened, but they did come in with different machines, CAT scans. They was monitoring me on that drug. I will say that.
Mm-hmm.
So I took that chance because he did make sense that day and said, if these people are dying, we need to give them something. They need to
Mm-hmm.
try something. And I
Mm-hmm.
asked for it. So I have to give him credit because I wouldn't have known, otherwise. And you see bodies piling up in these trucks in New York, like you're thinking like, hey, look, I got to try something because what they're doing doesn't work. So
Mm-hmm. Okay, so off the internet, I am looking at a question. Someone said, how exactly did you know that you had it? Like, at what point did you know that you had it?
my daughter's a nurse, and
Okay.
she said, "Ma, you need to go to a different hospital." And I said, "No." The first hospital said, they're not going to give me the test. So I was discouraged that the next hospital wasn't. So when I was unresponsive, they gave it to me at Southern Maryland. She
Oh,
said that my daughter talked to the
over in Clinton.
doctor. Yep. And she
Okay.
said that, my mom has all the symptoms of COVID. I know, I'm a nurse. If you don't give it to her, I'm going to have her transferred to Washington Hospital Center where she works. And they
Mm-hmm.
gave it to me. And that's how
Okay.
I found out. So 2 days later, and then they put a different color band on you and they ship you out of there so fast. They put N95 mask on me, took me to what you call a zero temperature room.
So
And
they
that,
put a mask on you even though you can't breathe.
yeah, they went and put a mask on
Brilliant.
me. Yeah, because they had to
Yes.
transfer you, away from the other rooms. They took me to what you call a zero temperature room. And now when I tell you they was flying down that hallway, they were like, we got to get her down this way. I guess away from, whoever was next to me. I don't know.
Jesus Christ.
Yeah.
Wow. Was that your experience also, Lady Nicole? We still can't hear her. I can
Yeah.
see her. I can
I
see her
know, me too.
smile,
I
but I
can
can't
see her.
see her.
Yeah.
Yeah. So yeah, that's why whether they like gave them anxiety medicine.
They gave you
If
anxiety
they gave them
medicine.
some type of
Yes.
anxiety medicine so that they can
Yes.
Oh,
calm
so they
down.
gave you anxiety medicine
Mm-hmm.
also.
Yeah.
Wow.
Yeah.
Wow.
Because
I
you
mean,
think, like, when you guys got to remember at the beginning, you just seeing people falling off left and right, and your
right.
anxiety is really bad. And even to this day, that's why I'm scared to go out. Like I don't know. You don't, because people may not know they have it. And then she said we can't afford to get sick like that again. My doctor said that. She said you cannot afford to take another round of that. Your body wouldn't even be able to handle it. Yeah.
Wow. So I mean, what happened? Like, I mean, not another round of COVID, but like, what happens next year flu season? You just gotta.
Well, hopefully over time, she said my lungs and stuff will build, your immune system. So I take like a lot of, vitamins and different things now. I try to eat way better.
Mm-hmm.
So I have to do what I can do on my end to help with that as well.
So definitely a life-changing experience.
Absolutely. Hey, Nick.
Wow. Hey,
Hey, you
Nick.
guys.
Welcome
Hey,
aboard.
Hey.
girl, I was just now getting off work, so I'm sorry to be so late.
That's okay.
We are happy that you are here. How's everything?
Everything is good for me. Coming along.
Good,
How
good,
are you
good.
ladies?
We were actually just
Hey, Nikki.
we were actually just talking to Lady Nicole and Tasha about their experience dealing with COVID-19
Mm,
because both of them fought it and beat it. So
Yeah.
shout
me
out to
too.
them.
Put me 3 on the game.
Are
I
you
know.
serious?
Yeah.
Yeah, I was tested positive in March.
Yep.
Yeah.
My mind is blown like right now. Like I just wow. Wow, I'm here with 3 amazing ladies. For those of you that are just tuning in, right here on the Uncensored Network, we are live with Nick from Nick's Nation. We are with Tasha from the T Spot, and we are with Lady Nicole from the Comedy Spot. So, like,
Yeah.
tell us your experience. Tell us how you beat it. Tell us, like, everything that you had to go through. Start with, well, somebody asked, how did you know that you had it? So, start from there, if you
Well,
don't mind
one,
sharing.
by me being in the medical field, I already knew about this virus way
Okay.
back in December, January.
Mm-hmm.
I just started having the symptoms. Not so much the fever didn't come first. It was more so like I just started coughing and my chest felt like it was caving in. Like it was really like a resemblance of pneumonia.
Right.
Um, and then from there, of course, I was like, okay, maybe it's the pollen or whatever. But as soon as I, woke up the next day and my body felt like I was being dragged. I felt like I got ran over by a scooter.
A
Like
scooter.
literally straight to the chest.
Yeah. Yeah.
Not the
I was
scooter
like,
though.
oh hell. So I went to the hospital. I let them know that I was a healthcare essential worker and they tested me. But the part that really I think became a mental drain was that you had to wait so long. Like I had to wait a week to
Mm-hmm.
get my results.
Yeah.
So it
Right.
was like, okay, you're gonna just send me home. You tested me for the flu. You don't know if I have a deadly viral infection, if it's gonna get worse or better.
Yep.
And you just sent me home to infect my entire household.
Yep.
Because I'm like, even when you quarantine yourself, we still have ventilation. We don't live in outdoor housing. So if I cough, the vent's still right there. So you really are putting your entire household in infestation. And I say the same thing when it comes to apartment complexes and things, like everything's connected to something. So,
Shared living spaces, absolutely.
hmm
So I
and we're
mean,
in
And
a house.
and the
So every vent in here goes to the same filter
Yeah.
downstairs. It ain't like
Yep.
we have multiple filters, but realistically, everybody's room is coming from one filter.
right.
Mm-hmm.
All right. So
So,
what were you saying, Lady Nicole?
I, I was I wanted to chime in. The other thing that is important, like I said, they don't give you gloves or masks when you leave, but you're supposed to quarantine and not go and affect other people. And then, like she said, then they send you home. You got to be with your family. I sent my family away. I split them up. You know what I'm saying? Had people watching them for 2 weeks for symptoms or whatever, but I got them out of the house with me.
I
Okay.
did the same thing. I
And
separated
like I was
myself.
saying about my 4-year-old, it's just they like how would they clean it? How would people if they went home, they quarantined or whatever? It ain't no sanitizer, ain't no Lysol. I don't but you spending money like on the Blue Angels show instead of making sure they got masks, hand sanitizer, things for people to be able to clean and survive to get rid of this virus.
Right.
Mhm.
Wow.
I think the other part
So
about it too is that it should be something that comes on nationally on television to properly show a person how to wear a mask. Walking around with a
right.
sock over your face with no
Yeah.
filter is not properly protecting yourself. Walking around with your dish gloves at the store is not protecting yourself. You know what I'm saying? You got people that's buying masks from people off the street, but they don't have no filtration system in it. So it's kind of like just because you got your face wrapped, or just because you tied a bandana around your face, so all the shit is coming straight up the bottom.
Right.
But that's what they
Wow.
saying on
There's
TV,
no proper
unfortunately.
training. There's
But I
no,
mean,
like you said, there's nothing on the shelves to even clean it. Like 401 and Comet, like that's not kicking it.
right. But I mean, you got this idiot in the office sitting here telling people to inject themselves with bleach and stick UV
Yeah.
lights up their
Yeah.
ass. So I mean,
Well, you ain't got to
here
worry
we
about
sit.
that because there ain't much bleach on the shelf either. So you ain't got to worry
Right.
about that.
Okay. I heard that. Yeah.
Oh God.
So
Wow.
this world is real crazy. But the coronavirus itself, I think the biggest thing that we're missing is that, I guess, being in the medical field, that it's attacking people that already have a lot of health issues.
Yeah.
And we have a lot of people within our communities that don't properly take care of themselves, and they do not use their medication properly. So when they do end up with a respiratory infection, even people that have sinus infections, they like have dead.
Yeah.
Someone
So
just asked off the
sometimes it's
internet.
just not. Hmm?
I said someone just asked off the internet, do you believe that you got it in a social setting like a grocery store or the Walmart, or do you believe that it was as a result of you being a nurse?
Who, me?
They just said that. I don't
Well,
know who
for
they were
myself,
directing.
I'm not sure anybody else a nurse, but for myself, it's, to be honest, I don't know.
Oh,
I
wow.
wasn't around nobody that was choking and coughing. I wasn't
Mhm.
around,
Yeah,
but
I
when you
was
out
at
there,
work
you really
6 days
don't
that week, so I know it was at work. Nobody in my house got sick. It was at work. That's the only place I went. I never got a chance to go to grocery store or anything like that, and we were
know.
still
I only
open to the
cook, so
public.
I know I ain't catching it in no grocery store.
Mm.
Yeah.
Um, so did you guys read about, I mean, you got people that are taking this very serious, like myself. I'm a
Mhm.
germaphobe. Like for me, I'm a germaphobe. Like I'm a real germaphobe, and I don't
Yeah.
just mean that plainly. Like I literally was like in here in dry
Mhm.
sweats and stuff because or I'm sorry, like cold sweats, just because I'm just like, oh my God, I don't know what to do. I don't know how to handle this, da 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 da.
Mhm.
So, but you have people, for example, in Loudoun County, Virginia,
Mhm.
police are trying to identify teens who tape themselves coughing on produce.
Oh wow.
What?
Yeah, there are teens that are running around like doing it like, oh, well, I got the COVID. Like
Yeah, they need to
on
be
people's
arrested.
And I would
produce
be
and
like,
stuff.
and I would be the
Yeah.
one like Big Mama and reach right over and just
Right.
smack their
They need
face.
to be
But you know what?
fly.
They tackled somebody else. A group of people tackled this one gentleman. Well, not gentleman, but this one guy that was like literally doing that same thing. And they
Mhm.
tackled him and they beat him down.
Yeah. See, people
Yeah, I
play too
believe
many
it.
games, and this is real serious. And I think until
Especially for
it
you,
hits home for
Tasha.
them, yeah, Nikki, I know you probably feel the same way. Until it hits home, even the people we know didn't understand how serious it was. And that's the
Mm-hmm.
only reason why I made the video, because people needed to know, like, this thing is deadly. It is not a game,
Mhm.
you know.
Wow.
When people say they take it seriously, I think anything that can affect the way that you move, the way that
Mm-hmm.
you think, your ability to breathe on your own should be taken
Mm.
seriously, especially when it's something that you're not and your physicians are not familiar with. You
Yeah.
Mm-hmm.
know, I
Because
don't
they
even
don't
really
know.
understand why it's so. It's like now all of a sudden it's so important to wash your hands. These are things that we
That
supposed to
what we
have
supposed to
been
been
doing.
doing.
But in reference to being sick and actually coming out in the streets, like that's when a person has the flu. Stay home. But I really think the stay home order is very important at this point because right now you're dealing with something that
Okay.
nobody's familiar with.
Okay.
So when
Right.
you really get sick, and you a single mother, or you out here trying to, get yourself together, or like right now people are facing unemployment. I mean, it's like an epidemic
Yeah.
that's
The
hitting
epidemic has
everybody.
gone
It ain't just
We,
viral.
DC.
we wouldn't have never
It's a
thought we
Mm-hmm.
would see something
nationwide
like this.
thing that's even hitting countries. I mean, this thing is powerful. So if
Yeah.
something like that is spreading around, I'm not playing with it.
So what do
Now
you
when I
think?
come home, I take my wig off. I even shake this thing out in the garage.
You don't know?
I airs it out. Mm-mm.
Oh God,
I
y'all are
don't want that. When I
hilarious.
come home from work just now, I was rushing. I hit that garage, child. I get butt naked in the garage.
Mhm.
I'm not
Yeah.
bringing nothing from out in the house. I'm dead serious. Like, I even grab a towel and wrap my
Yeah.
whole ass up. Hit them steps,
Yeah.
hit that
I know
shower,
that's right.
leave my wig out there, put a new one on, or put my bonnet on. Like, because
I
it's
know
like you
that's right.
don't know how you're carrying it. You really don't
Mm-hmm.
know how it's
Right.
coming in and out of your home. You don't know how you catch it, and you damn sure don't know how to get rid of it. And I don't think laying around for 14 days is gonna cure it. I
Thank
do
you.
feel that myself, my biggest worry is following the studies because I want to know how would this affect my body in the future.
Mm-hmm.
Mm-hmm.
So,
If
uh,
something attacked me like that.
Tasha was sharing how even now
Yeah.
she catches shortness of breath with
Yeah.
different things that she does.
Like
Is
coming
that
up
your
and stuff
experience
too.
also? Nick, I said, is that your experience also? Tasha was sharing with us how, like, even the simplest task anymore kind of like wind her and they, kind of take her breath out of her. So, I mean, is that your experience also?
No, that's not my experience now. I kind of took like the old school method of being in school. It was kind of like if you don't move it, you lose it.
Mm-hmm.
So another friend of mine, he's a police officer. He also had it, and so we quarantined. He was upstairs at his house, and he let me stay downstairs at his. And we, did this little battle together. But one thing I kept telling him is stop laying around, stop staying still, get up, move around. There is a reason why every time you turn on the news, they tell you to do exercises at home.
Right.
I mean, it's a reason why certain things are being displayed. They may not tell you straight up, but sometimes you gotta take heed to certain things. And they say if you don't use it, you will lose it. So
Wow. Oh, once again, UncensoredNetwork.com. We are here with Lady Nicole from the Comedy Couch, Tasha from the T-Spot, Nick Nation. I'm sorry, Nick from Nick
Nikki's
Nation.
Nation.
Yeah.
Yeah.
So, anyways, everything that you guys have gone through, and I'm here with like 3 amazing women that have fought and beat coronavirus. So, with that being said, I need to know what is the number one tip that each one of you can impart on our listenership, our viewership, that, will keep people safe. If you had that one thing that you could say to somebody to say, you know what, this will keep you out of harm's way, what do you think that thing would be?
Prayer. I believe God said he won't put more on you than you can bear. So you gotta stay prayed up. Because you can't be cautious on something you can't see. That's like someone saying watch your step because you see that you about to, there's a possibility you may trip. Or, watch the door because it's about to bust you in the face. But this is something that you cannot see, you cannot hear. So I say you got to stay prayed up.
Absolutely. I know for me, a lot of prayer. Being in the hospital, I felt so alone. But,
I'm so sorry.
Speak on that, Tasha, in reference to being isolated like that. Because I even was calling, checking on you too. But being isolated, does that really affect you mentally? Do you think that's slowed down your healing process? Being separated from the world?
Did, but even I was telling him earlier before you got to see when you're on the oxygen and stuff, you can't really move. At first I couldn't do anything. You used to able to go to your bathroom, you can't. You're dependent on somebody to bring you a pot. So it was different. For me. And my aunt would send me inspirational messages to listen to every day. Because I was really, they were giving me anxiety medicine. Nikki, it was bad, and I just, like you said, you have to be prayed up. I would just talk to my kids through FaceTime when I could, and that's only when I could, And one thing she told me was just build your immune system while you're there. And she said what you said, you got to try to get up. And I'm like, the cord is not long enough. Call them, tell you need a longer cord,
or a
because they
portable
had
oxygen tank.
It was, because it's not even a tank. It's coming through like some type. They had it on the wall, and then it just runs through your nose. But you're right. You got to try to move around, and that's probably why I'm having such a hard time now.
What about when you came home? I know I spoke to your family members, and they were saying that you may have to come home on oxygen. Did you have to come home on oxygen? And
I was using 1 liter. And now I don't use it. I use the inhaler when I need to, but I haven't been running up and down the steps a lot. So I have to start moving. I'm going to start walking. It's just that
yes, you
to go
do.
outside is scary because I don't want to get
girl,
sick.
you better do like I do. You better walk laps around that kitchen, walk around the living room, walk around
Zumba.
inside your house.
Zumba.
But I know your foot was messed up, so don't do too much. But definitely still do something, or sit there and act like you about to punch something or something. Just keep your heart rate up.
I got a few people you can punch if you'd like. I'll send them your way.
Send me 2 of them, Marcus.
I'm just saying, I got a list.
Right.
But okay, so yesterday, me and Emoji is my fiance. Me and Emoji went out. We went to the park and we walked the dogs. This will be the first time that I've experienced since this pandemic began that people were not wearing masks.
What?
I had.
Mm.
I'm telling you, it was a couple of people, but overall, people was out there. They was jogging around and they heavy breathe. Look here,
Mm.
look here,
Sound like a turkey.
yo. No, I'm serious though. It was like I was really like, and emoji's like, wait, man, because you about to panic. I'm like, yeah, I am, because I'm about to go back in the car because this is too much. Because people were out there.
Look,
They weren't wearing masks. They were being active. I saw people dapping one another up and like,
Wow.
stop it.
Well,
Like,
Lady Nicole, what are some of the experiences that you have, or what are you still going through that you feel may be affecting you since you had COVID-19?
well, the health part, I was first off. The reason why I called 911, Nikki, is because I couldn't smell my pussy. I was outside going.
You know what?
I'm
That's
done.
the first.
I'm
I
leaving.
said, I'm one who can smell like alcohol or somebody's breath as soon as they hit the door. I can't smell now. Oh, you should have seen me with the pad all up in there. I said, well, I can't. I called 911. I said, man, please send the COVID-19. I cannot smell the pussy.
So you
I
lost that good sense of smell.
Right. It wasn't all that bad because some of my symptoms, I get like a little sick before my period. So I was popping Imitrex for my migraine. You know what I'm saying? I already had asthma, but it was allergy season, so I was already like on my sick plan, which I think maybe helped. But the thing that was real scary for me was the anxiety about my children, my family, and the 4-year-old. I had to take her on Friday at 1:00 in the morning. I about cussed out the PG County paramedics. She's sitting there with labor breathing. Anytime a little girl, you can like going in or their stomach go in like they sucking it, they can't breathe.
But yeah.
He gonna say, "Did you call a doctor?" What the doctor gonna do right now? For the baby, and stuff like he was really trying to talk me out of it when she got labor breathing, but she was COVID-19 negative. Thank God.
Oh, that was
just
good.
the asthma. But like it's scary, and then the first thing in my heart was guilt. You know what I'm saying? Because the one thing I worried about the 14 days was, can I get retested or can the baby girl get antibodies? I had 4 children, but the baby girl is the one with the most problems, autism, lung disease, and everything. So that's where my panic was and stuff. But during the times I'm people were like, you got to stay in the house or whatever, and do what you do. When I go out the house and I have to, I already was leaving for essential things. That's probably how I got it, at a grocery store, the pharmacy, in the first place, because I have 4 children who were heavily medicated, especially myself. So, that was my life. And 2 of my boys are on medications that are narcotics. You have to go to that first pharmacy
with that ID,
like call and say, do you have the medicine? I have to go to pharmacy to pharmacy, stand in line with these sick people, and in Southeast it's really bad. I don't believe heroin addicts or crackheads can get it. I really don't.
I don't know. The crackheads are pretty resourceful.
I said the same thing. That one thing they do is they know how to clean, honey.
Them crackheads, I'm telling you, they get their hands on everything. Hey, I got this COVID-19 vaccine back here. It's what it is.
Give me round back.
Yeah.
Oh Lord.
Just saying.
My question that I did have in reference to it that kind of scares me is, can I get it again? Like, is this something I can catch again?
This is what actually I pulled that answer up, and they are saying that people that have tested positive and beat it still can get it.
Yeah,
they said
the doctor told me that too.
Yes, they said that you can get it again because at this point it would be a mutated form. So it wouldn't be the first, because now your body has developed the antibodies, which, by the way, you should sell. I'm thinking business idea here.
Right.
Got these antibodies, bitch. Like, what's up? But they're saying that you can still catch, that you still can catch another strain of it. So still continue to
I know,
quarantine yourself.
I had looked at a copy of my friend's results because when I first seen when he went to the hospital and they gave him his results back, they didn't test him for as many strands as they tested me. I don't know if it's because I went to MedStar and I used to work MedStar. I don't know, but they had tested me for 3 or 4 different strands of the COVID-19, and I was tested positive for 3 of them.
Wow.
Okay.
When I looked at his paperwork, he was only tested for I think 1 COVID-19 and the flu.
Oh,
So
okay.
it's so
Wow.
scary that they have so many different strands and different tests test for different things. It's scary.
Yeah.
And then if you can get it again, and like Tasha, she's already, having problems with her respiratory system, hard to catch breath. It's like she done caught damn asthma and bronchitis, and she damn girl.
Right. I had pneumonia and the COVID at the same time. It was crazy.
You gotta
I
be
am
like that
so
lady
proud.
said.
I'm so
Shut the
proud to
door
say that I
down.
know
Shut
3
your
people
phone
that have
out.
survived it.
Shit, you
I
better even
know.
crack the damn window. Hey,
No.
Wow.
don't make sense.
I do want to say something, though, Marcus.
What's that?
Their hair pretty though. Like they ain't been nowhere.
They are gorgeous. Like
No, look,
to think
I
that
did this for
to think
y'all.
y'all
I
went through
promise.
COVID-19.
Girl, no, this wig spray on the front. You don't want to see the back. That's why I keep doing it like this. Woo!
Look, I
No,
had a
but
bomb.
when
This
you
thing
hear,
gonna turn into a barbette in a minute. And just fry.
I know, right? But when you hear
that
that somebody has gone through COVID-19, you think that they're gonna come out looking like Thriller, and y'all look gorgeous. So
Oh,
Good.
thank
Hey,
you.
Nikki, tell him it wasn't like this for a minute.
Hey, that's so
I got to put this
Let
proof
me send in some of my bonnet pictures.
right.
Put your face on.
But you
oh
gotta
man.
call them. Like I said, my family and friends are the worst ones treating me. They be like, are you sure we okay?
right.
No, I'm not really, but we believe in God. Like I need you
That's
to believe
right.
in God too.
Yeah.
That's all we can do.
I
Like,
don't know what it is about women. It's like we can be going through the worst pain. At least myself, I could cough and it like that pneumonia cough. It sit right. It burns to the
Mm-hmm.
soul.
yeah,
And you just don't complain. It's like you just keep pushing. Like Lady Nicole said, when you're a mother or a caregiver, it's kind of like, what's the purpose of complaining when can't nobody
Yeah.
else, talk what your problem is? I'm like,
Right.
shoot. And then I really feel bad for the people that think smoking weed cure everything. Because you
I
smoke
know.
weed on this coronavirus, you was out of here.
well,
We're
I
out.
smoke weed. I got it. So
They better
make
not
sure
be
all the
passing that
weed
weed
smokers.
around.
I know that's
Girl,
right. Puff puff past
Well,
my
I
ass.
got
puffing
my
on
Right.
own.
trash.
Right, I
Puffing,
got
you
my own
be
jag. I don't care
choked to
who.
death.
You gotta have your own jag. And we 10 feet apart. We need to be smoking over the phone. I don't need. You need to be smoking by yourself. You need to be.
Smoke
Yeah.
party.
All right. Have a good day.
No, I mean,
But you know,
I'm
with
like, little things they say, if you smoke or whatever, like you can't smoke with the coronavirus because it's a respiratory. How the hell you gonna tell somebody that's already buying cigarettes for $9 a pack that they can't
Right.
smoke their
Oh, they
cigarettes? It's
dead.
kind of like
They dead.
that's all you can offer us as far as advice. You can't tell us nothing else. And
Well,
then
just
next
don't
minute they
smoke
said
and good luck.
antacids is supposed to be a medication that's supposed to help you. So I don't know how an antacid for your stomach is gonna fuck with the throat, but whatever works.
out
Yeah.
with niggas.
Child,
And then
take a little
should have seen
acid,
me.
smoke the weed. Look at him,
Here,
he got
take one of these. You be all right. The fuck?
You
Come
know
on,
what,
Oh
Nikki?
seriously.
no.
Nikki, the whole time I was sitting there, I kept smelling my underarms, young. And so I went to the bathroom and like,
Wait, hold on. You can smell your
yeah.
underarms, but not your pussy.
No, she was trying to
No,
smother my arms.
and I realized that after this, I really do have like an issue or whatever. Because normally, like if I get in the shower and I don't brush my teeth, I like keep washing and shit. So I was in the shower like 20 minutes, just mentally like, am I clean yet? Because I kept
Oh.
smelling.
I'm done.
Well, wait a minute. How long? What was going on? We need some
Yeah.
follow-up
Doing that
questions
piss
here.
test. She rolling
I
up under
prayed to the
underarms. Hit
Lord.
that
I prayed
underarm
to the
one.
Lord.
Right.
I said, Lord, if I've been using my nose and my superpower wrong, I promise that if you give it back, I will tell people when they say, I will
Superpower.
tell them. I won't. put my nose in my shirt and smell my deodorant anymore. I said, Lord, please get this out of my system.
I'm dead. I'm
That's
dead.
like now you gotta ask the kids. I know you ain't washing their ass because
Right.
I know you ain't washing their ass. Just because I can't smell don't mean you ain't go wash your damn ass.
Wow. Oh
Them
wow.
kids probably said you ain't gotta take no bath. The mom can't even smell.
Right.
I know I could have dealt with one of my children because I could smell him a mile away. I'd be like, go wash.
Welcome you to the
That's what I
Uncensored
said.
Network. For
My
those
superpower. That was my superpower.
You ain't
For
washing
those that
their
are tuning
ass.
in, this is the uncensorednetwork.com. We are talking to three amazing ladies from three amazing shows that have all beaten COVID-19. So get on their level because they are up. Like, this is an amazing conversation.
I don't
And
want to
they
say nothing else because
are
they may give
here.
it back to me. I ain't trying to play
Nope.
tag now.
We're not going to speak that into existence. But off the internet, I do have a couple of questions. One coming from, I'm not even going to say that name because you don't want to be identified. But
Okay.
they said, with everything that you've gone through, how is it that you are still able to breathe? Like, our everyday activity? I think we already addressed this. They said that everyday activities, for those that didn't tune in, they did say that everyday activities are a little strenuous sometimes, but not with Nikki though. Nikki says that she's been exercising and she's been doing the most to keep herself and keep her immune system up, and just do different things. So somebody else said,
Plus, we got to read.
No. They said, how do you think that?
I want to know how you had if people that got COVID-19 can still smoke that weed. I want to know that.
Hello.
I want to know about the people that are out here and they feel like it's cool as long as you got less than 10 people on your house.
Can you hear me?
We can hear
we can hear you. No, we lost.
Well, ladies, I might have a question. You know how they said as long as it's under 10 people within a house or whatever, it's considered a social distance event. So I've noticed that there are people that are having get-togethers and all that other type stuff as long as it's under 10 people. Do y'all think that that's appropriate or
not right now? I don't think we should do that.
Sorry about
that,
lady. Somebody called me and interrupted my broadcast. All right. No, and then somebody else said that they are so proud to know that black women defeat everything. So can you hear me?
We can hear you.
Okay.
My question I was asking.
They said black women. They said black don't crack. Black can defeat anything. So
kiss that to the store.
Bam.
My question, Marcus, was in reference to the people that feel like as long as you have under 10 people in your household, it's okay for people to come over. What's your opinion on that?
I will say this. I got some backlash last weekend because I had invited the WRTR crew over.
Yeah, I can't hear him.
To just to. Can you hear me? Okay. I had invited I had invited the WRTR crew over just to people had masks on, but we were like singing karaoke. We were just having a good time. And, we were drinking and all that other stuff. One thing that people didn't see, we Lysol down everybody's clothes and garments. We maintained, with the exception of when we were singing and stuff, we were close then, but we were still observing social distancing, but none of us had been out, and we've been in contact every single day, meaning, verbal contact. We know one another's habits. So we kind of got some backlash from that. I don't believe that groups of 10 or more that are irresponsible need to be together. And not saying that only irresponsible people get COVID-19. That's like saying only gay people get AIDS. So, I mean, you got to kind of play your field with that. What do you guys think?
My opinion is I really do not feel that standing 6 feet away from somebody is going to prevent you from something that is an airborne disease.
Right.
I don't see that.
I mean, does COVID get tired after
I
6
still
feet and go, bitch, I'm tired. I ain't walking over there. Like,
You
I
know
mean,
what? I seen this post on someone's page. I think it was Brian or Skip one of them, and he was like, "So, but the of adults got to be 6 feet away from each other. So you telling me that the midgets only need to be 3 feet away?"
It's the truth, though.
Oh Lord, I just don't see how that is protecting you per se. And I say that to say that if I'm in the street, I have to be 6 feet away from you, but I can still see the back of your scalp.
Right.
And we inside of the house, it could be 6 suckers in here. I mean, we got 5 bedrooms. So how many people you think living in this blinky?
Right.
You see what I'm saying?
Look, I ain't
So
inviting nobody over, so I ain't even worried about it. Don't even come
It's
over
like
here.
it's so tricky. It's like as long as you in your house. Now let's say I'm in my house, but we're living in a house where I rent to my cousin, and so you know what I'm saying? Like people have multi-sibling households. So as long as I'm under my roof where I'm paying the bills, I'm safe. But if I step outside, I gotta be sick. Ain't nobody. You don't even live. Your furniture is not designed. Your kitchen table is not designed for everybody to be 6 feet apart from each other.
Right.
It's
So
not.
it's like I'm safe in the house, but I ain't safe outside. It don't make sense to me. The 10 or more people, it doesn't make sense to me, especially if I did want to have somebody come over. I gotta count y'all before I go to jail when it's already 5 of us, 6 of us in this damn thing. It depends on how big you counting as a person. I might be 2 bitches.
Right.
So now I'm 2, because it's too much. It's too much. I say shoot, it's too much.
What? No, but another thing. So you got all of these different cases developing every day. So, for example, I mentioned it earlier in the broadcast, but we are up 989, almost 1,000 cases today, new cases, with 30 new deaths, for a total of 25,462 cases right here in Maryland alone. That being said, we have total deaths of 1,281, and you got all these people that are out here protesting about these. Oh, well, we're not gonna stay at home, and just staying at home, that's not gonna make it go away, blah 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 blah. Okay, so what do you think that the solution would be? And that's kind of what I want to ask. Like, what do you guys think that are some solutions that we could put into place that people didn't necessarily have to be in their house all day, every day?
Oh, can I answer this one?
Absolutely. You got it, Nikki.
I can't hear.
I think the first thing that needs to be done.
You can't hear me?
I can hear you.
No, I'm saying, I don't think.
Go ahead.
Can you hear me, Lady Nicole?
Yes, yes.
Okay.
I can hear Nicole.
Okay, so my opinion, I think my opinion is that people need to use their minds more wisely. If you have this much time to sit at home and you want to protest something, you need to be protesting the CDC to ask them why don't they give us more informative information? Why aren't they giving us more resources? If we are sitting at home, we don't have nothing to really filtrate our system. They're not coming around giving us filters. They're not coming around doing nothing. You're just giving us scares. You're saying, oh, it could be your internet service, the Wi-Fi, the 5G. But then you're going to send these kids to my house with these computers and think I'm going to become the school teacher, the coronavirus protector, the bill provider, and pay all the bills. No, if you want to protest something, protest that your government gives you more information as they receive it instead of just telling you to stay home. Because realistically, they're trying to keep y'all off the street, but they're not giving you enough information to make you feel secure.
Did the CDC ever contact y'all? Because they kept contacting me the whole time.
Yes, they sent me a letter to clear me.
They sent you a letter? What?
They sent me a letter to clear me. And they kept.
You get a diploma after this? Wait. Wow. Okay.
Yeah, they contacted me. The health department contacted me, and then after they talked to my physician and the health department, the CDC actually sent me a letter in the mail to clear me for the virus. But they still in the letter was saying to still use your PPE, your personal care equipment. But Once again, they don't provide it, and you just got people out here now making random, using fabric and materials, making masks. But y'all need to understand that these masks, without the proper filtration, is not protecting you.
Yeah.
You're just breathing in more dust mites. That's all you're doing. Cotton nose dust mites.
And
it's
some of y'all
allergy.
got roaches anyway, so.
Oh, baby.
Mm.
Ooh, Lord, I can't do it. Baby, being in the house with raid, roaches, raid, ice, coronavirus, smoking your weed. God.
That's what I'm saying. Some of y'all got
Look,
roaches
and
anyway.
Foster stay in the sucker with them. Y'all playing hide and go seek in the refrigerator.
Right.
Peekaboo. Wow. Okay. So,
Hey, I forgot about them roaches. I ain't seen one of them so long.
I know, right? I wouldn't know what to do if I saw one.
And you know what? Everybody is.
I left them at King Square.
Exactly.
Oh, no, you didn't hit Landover like that.
Yeah, I don't want them no more.
Hey, I live in Baltimore, so I live in Baltimore.
You ain't got mice. You got them rat cats.
Exactly. Raw, them joints that be popping out like. That's why I got 2 big dogs. Anyways, so moving forward, so we're talking about coronavirus. We're talking about everything that has happened under the sun. What do you guys think about? So we're quarantined. We're everybody's keeping away from one another. Once they open up the states, what do you feel is going to happen? Like, I mean, do you think that there's going to be an uprise?
Because it's going to be a whole lot of people stealing. I can tell you that because ain't nobody got no money. I'm still surprised how busy Walmart and stuff is for everybody to be laid off.
They're using their unemployment money.
That's that stimulus check,
honey. And that thing, I don't even know how far. They must not have never had a dime before, because that little bit of money ain't go far them shit.
Nah, I know.
And one thing that ain't stopped, that damn Pepco still coming in, Washington Gas coming in, and WSSC.
I came home, the bills was waiting for me, honey. So I don't know what that
Now I'm sitting right on the island. The kids opened up, put it right on the island, like, here you go.
Right.
So
them bills are out of control.
We're not going to cut you off, but you will be responsible for your bills. So if you just thought that it was going to disappear, I
think that's what they must have thought, because the people still want their mortgage and their rent.
I think that everybody thought that it was going to be kind of like a thing of where, oh, well, we're going to just do forgiveness because coronavirus. I mean, we're going to keep you on. We can just give you this stuff for free.
I think that stimulus check in my mind was just kind of like a way to bypass the Americans' eyes from always having so many questions. Because it's like sometimes people see money and that just like, oh, we good for right now.
The moment
people needed to stick together and go to these health departments and protest there and put up these picket signs out front saying we want to know more. We want to know what's really going on. It's no way in the world that you have people out here working grocery stores, Walmart, McDonald's, and it's a hazard to come outside the house. You can't tell me that if I step outside of my house, I have a possibility of basically taking my own life.
Right.
So yeah, you making people come to the dumbest places like McDonald's.
Oh no, McDonald's comes to me. I'm fancy.
Oh, bad and bougie.
No, but honestly, you made a point, because I mean that's how people thought it. I mean, that's people's mentality. And the moment that people started hearing stimulus checks and then checks started hitting people's banks, you didn't hear. When was the last time you heard anything about 5G? Think about it.
I ain't heard nothing about nothing, especially Shanika Boone Tika. But them damn 9-12 kids, she probably over that thing.
Oh my God. Oh, speaking of which, did y'all know condom sales are down?
Yeah, because
condom sales,
the condoms be fully stacked.
I would think that they would be up. I would think that they would be up. So at this point, I'm wondering, okay, once we reopen the states, is it gonna is there gonna be like a thing where
y'all was the men were saying that the condom sales is low right now because everybody's stuck at home with their wives and stuff.
But I'm saying, but are they really?
Ain't no freaky deek in the street
and
right
now. The divorce rate went up. I'm hearing people not getting along.
Yes, people are finally discovering who their spouses are. And that's the thing. They're like, oh, well, I don't like this motherfucker. Oh, well, I don't like this woman. Like, it's like, it is what it is.
Look,
And people are
lady
really in their
said
feelings.
she can't smell it. You ain't touching it, so you
Right.
get out of here.
You gotta make that thing right.
Ah!
Oh God.
Y'all got a quarantine boo or no?
Do what?
You got a quarantine boo? I don't know if you're married or not. Are you, Nikki? You ain't got no quarantine boo? Mm-hmm. Yeah, let's talk.
What did he say, Nikki? Because I can't know.
Let's ask him, do I got a quarantine boo? Don't worry about what's over here.
Oh, you can't. Tasha can't hear me.
I need a quarantine boo. I ain't got one.
Tasha can't hear me.
Yeah, we can hear you.
No, I don't think Tasha can.
Talking foolishly.
Oh. Anyways, but yeah, like that's what I'm talking about. So I mean, people got quarantine booze and everything, but condom sales are way down. So is there gonna be like an uprise in the visits to the free clinic after the pandemic? I mean, what are we dealing with?
Well, I did hear in a conversation that the abortion clinics are open, honey.
Are you serious?
That's not essential.
Wow, I didn't know that. They're essential, huh?
No, they not.
Essential if you gonna pay. Yes, the hell. If McDonald's is open, why the hell not the clinic? Yeah. I ain't say the free clinic. I said the pay for clinic.
Right.
The one you got to pay before you go to the lab. That's open.
Wow.
This word from the street.
So we got about 3 minutes left on this broadcast here on uncensorednetwork.com. We appreciate you tuning in. Nikki from Nikki's Nation, I need to know, what are those imparting or those last words that you want to give out to the people?
My parting word. Do not listen, Marcus. I don't have no booze.
You said
over
what?
Here. Okay. Now, I ain't got no booze. You said, do I got any COVID-19?
I'm just saying. Everybody need to look. Young Kitty, Young Kitty be like, purr, somebody need to touch me. Yeah, you know what I'm saying? Like, it is what it is.
That's
exactly. So, I mean, I ain't mad at it. I just want to know. But go ahead.
No, just stay safe out here, for real. I mean, make sure that we just learn to really just take the time. One thing I like about the COVID-19, I will say this, is that times have slowed down. And it just really teaches us how to just go back to just being kind to one another. You know, even if I do go out and I'm still out here working, you know, we live in such a fast-paced world that we have always been known to talk at people and not really have conversation. So really right now, it's just really just slowing us down. So that's the only thing I will say, is that it's different.
Okay.
It's taking us through differences. So just continue to be kind to one another. If you got an extra pair of gloves, pass it to someone doesn't have it. If you see somebody with a mask, it looks cotton, ask them, you know, pick up some coffee filters. If you guys are donating masks and you got somebody else donate your coffee filters, you know, I know everybody got Keurig now, but people used to have regular coffee pots. Donate coffee filters or something to your nursing homes, or, you know, just anything that we can try to just be kind to one another. I think this is the time we really need it.
I agree.
And Tasha, your words?
For me, I would just say take time to, one, stay prayed up, and then make sure you guys educate yourself on the virus. You got to know what's going on. I know I'm addicted now to CNN and just watching what's going on.
Yes, girl, me too.
Yeah, I'm so addicted.
CNN 10 or something.
Yes. And like Nikki said, it made us all slow down. You know, we were running fast-paced lives every day, going from work to radio, whatever we had going on. I know I was, you know.
Yeah,
it allowed me, as a mother now, to just slow down. And yesterday, just the small things, both of my children was in the kitchen with me, and that's something we haven't had time to do in a very long time. And we just had a good time. And my daughter was the one, she said, you know, Mom, I'm so glad you're home, because normally we just run 50 miles per hour. So, you know, a lot of bad things happened to us during this process, but a lot of great things, you know, family time
came out of it.
Came out of it. And I thank you guys for coming on today, and Marcus, for you interviewing us and us being able to share our story with everybody.
Thank you. And I'm so proud of you ladies, like all three of you. Like, it's amazing to talk to people that have been through it. So thank you so much for sharing your stories. Thank you so
Thank you
much
for
for
having me.
being
Thank
here
you.
with us
You.
today.
And Tasha, it was so good to see you.
It was
honey.
good to
I'm
see you, boo.
glad.
I miss seeing you guys. You know, I know
Yes.
You
me and you
too.
always see each other,
Yes.
so I miss
Love
seeing
y'all
you.
much.
And love you too, Lady
Look at
Nicole.
Nicole.
All righty. So we're logging off. It's the
She went in and out.
uncensorednetwork.com, Uncensored United. Once again, ladies, thank you so much for your time. Thank you so much for the blessings of your experiences and sharing with what you know with the nation. So, man, this has been a great show.
Thank you for having us,
Thank
Marcus.
you.
Now give me your Uber code with that makes
Thank
sense.
you,
Will
Marcus.
do. Will
Yeah.
do. Thank you again, Uncensored Network and Brian. We'll holler.
All right.
All right.
Bye bye.